Good afternoon. Mike Jones, Fire Chief, City of Fredericksburg. Again, bringing you updates from City Council chambers in relation to the COVID-19 crisis and those things that we can do to try to help the situation, flatten the curve, and make things better. We'll start off with the statistics from the local health district today. We're up to 439 cases, but that's only 13 new cases, so we're starting to see maybe a flattening or a downward trend of the total number of new cases each day in the health district, so that's a little bit of good news right there. Fredericksburg is now up to 28 cases. We are working with the health department to do contact tracing on all those, and we have those situated out and mapped out to make sure that we're not having any type of outbreaks in the city or particular areas of concern, and right now we're in good shape there. Stafford has 225 cases, Spotsylvania 131, King George 30, and Caroline 25. Again, we're staying steady with 13% is the total number of people that are actually tested and have COVID-19. So of all the tests done in the health district for COVID-19, only about 13% of them are actually testing positive. So, and that's been holding steady now for several days, so that's a good sign too. Both that number and the number of people on ventilators in the hospital are less than the statewide average, so that's positive for the Rappahannock region as well. And we only have 16 positive patients in the hospitals at this time. So again, that's all good news. The statistics for the Commonwealth of Virginia and the United States we'll post on the written document that we have available to us so that you have those if you need them. But just as a watch-wise, we have now over 1 million cases of COVID-19 as confirmed in the United States of America. So while we're starting to see maybe a little bit of a downward trend or hopefully a leveling off, we still are seeing cases new every day. A lot of questions in this pandemic about testing and who gets tested and how can you get tested and all those things like that. And the fact that Virginia is slow to ramp up on their testing. We're still only about 2,500 people a day. We need to be between 4,000 and 10,000. I don't know when we're going to get there, but right now we're still a little bit lax on the ability to get testing done. But who gets tested and why do they get tested? So let's talk a little bit about that based off of the CDC guidelines. And we'll talk about 4 main areas. First and foremost are those people that are hospitalized patients that have some type of illness or sickness and the signs and symptoms that are consistent with COVID-19. They're going to get a COVID test. The next group is healthcare facility workers or workers in congregate living settings and first responders with symptoms. So all these people that do have symptoms, again, consistent with COVID-19 symptoms, which is your fever, your cough, your difficulty breathing, maybe even aches and pains, headache, sore throat, things like that. And then the next group would be residents in long-term care facilities or other congregate living settings, including prisons and shelters, and they have symptoms. So we start off with hospitalized patients that we know are sick, and then we start looking at people that maybe are not in the hospital, but they do have symptoms. And then persons identified through public health as they do their contact tracings or in clusters and cluster development. So in other words, if they start to see a certain number of people in a certain area, whether it be a subdivision or apartment complex or long-term facility, anything like that, they're going to start doing a lot of testing there to see how many people are actually positive or maybe asymptomatic and positive as well. So those. Remember, first responders with symptoms move to the highest priority list for COVID-19 testing, and that's just to try to keep our people safe and to keep you safe in case we have to respond to emergencies and things like that. We're also going to provide you in our written report a pictogram that talks about the steps that you can take to continue to limit the spread of the virus among your family and others. So again, it never hurts to have those reminders out there about covering your cough and washing your hands and all that, and we'll have a pictogram that we'll send out with our written documentation there. Again, we can't emphasize enough, we have a lot of independent and small businesses throughout Fredericksburg. Please patronize those businesses. Give them your dollars if you have the availability to do that. Please get curbside delivery or takeout or whatever you can from our restaurants. They need your help more than ever now. City government's still open, so if you have questions or concerns about businesses or building permits or zoning requests or anything like that, we do have people on staff in the buildings to be able to answer your telephone calls or any type of electronic means such as email or text or things like that. Again, finally, let's keep up the social distancing and the personal hygiene habits. They do go a long way to help limiting and taking care of the spread of the virus. Thank you very much.